Hi, my name is Paige Doherty, and I am a level one athletic training student at North Central. And today we are going to discuss the topic of pregnancy in athletics, including exercise, postpartum return to sport protocol, and we're going to discuss the conditions that are secondary to pregnancy, such as pelvic floor dysfunction as well. So our guest today is Dr. Mateka. Dr. Mateka, do you want to tell the audience that's watching a little bit about yourself?
Sure. So my name's Allie, and I am an athletic trainer. I have my doctorate degree in athletic training from ATSU. And I also hold a pregnancy and postpartum corrective exercise specialist certification, so PCES. And that's just a really specialized certification that allows me to modify and correct exercise for both prenatal, so pregnant and postpartum women, especially in relations to, as you mentioned, pelvic floor dysfunction. So that includes urinary incontinence, prolapse, and it also includes core dysfunction that we usually see with pregnant and postpartum women. So looking at things like diastasis recti or abdominal separation.
Love it. And then I know you have published work in the topic of caring for pregnant and postpartum athletes. Do you want to tell people about that a little bit?
Sure. So I do have a published chapter in a textbook, and it is about resistance training in prenatal and postpartum athletes, really. So I can send you that link as well if you want to share that. And then we also, my partner and I, we were looking at athletic trainers' knowledge on how to basically work with pregnant and postpartum women. So did they feel comfortable and knowledgeable about modifying exercises if they did get a pregnant or postpartum athlete? And largely we found that the answer was no. That it's, and it's not included in our education. So yeah, most athletic trainers felt that they weren't able or felt comfortable at least knowing how to modify for a pregnant or postpartum athlete. We also interviewed the athletes as well and surveyed them, and our research found that they were pretty 50-50 as far as we only interviewed female athletes, I should say that, but they felt that their athletic trainer was knowledgeable enough to help them during these changes. And so I thought that was a very interesting and eye-opening piece of investigation there, that the athletes feel that we can help them and we feel that we're not educated enough. So obviously there's some gap, right, in that education. So
Yeah, absolutely. I think even when I was going and looking for research articles for part of this, it was very limited research articles, but everything in the articles was very educated and had a lot of good information. So I 100% could see that. So I just have a couple questions. So the first one is, what kind of caused you to start your research and interest in the topic area?
Sure. So I'm a former collegiate athlete. I played soccer, and I grew up doing gymnastics, so always been in the athletics arena. Obviously love athletics and athletic trainer. But it wasn't until after the birth of my second child. I have 3 children. They're 6, 4, and almost 3. So after the birth of my second child, when I experienced pelvic floor dysfunction, and I wasn't able to really run and work out the way I had before. And honestly, I felt such a huge loss of identity, right? Like fitness and athletics was part of who I was. And when I wasn't able to do that, that was quite shocking to me as a mom and a former athlete. So that's what's really sparked my interest in it, first and foremost. And secondly, I should mention that my second, he was born in November of 2019. So by the time I really started realizing that, wow, something's not right with the way I'm functioning right now, that was about March 2020. Gotcha. And what happened in March 2020? COVID hit. So all of the pelvic floor, I finally figured out, oh, there's like this thing called pelvic floor therapy. I didn't even know that existed. And kind of annoyingly, my OBGYN didn't recommend it either. Like no one really pointed me in that direction. But, I found it, and I was finally made an appointment, and then COVID hit. And all the offices closed down. And the office that I had connected with wasn't doing anything virtually either. So that's when I, again, I'm like, okay, I'm gonna have to figure this out on my own. And that's when I found this pregnancy and postpartum corrective exercise specialist certification. And it was presented for, it said healthcare professionals. And then when I inquired, they said, it was instructed by a physical therapist, and most of the students are physical therapists. And I went, you know what? We're so similar, right? We know this. When
Right.
we athletic trainers and PT, it overlaps a lot. And I was like, I can do this, right? I have a doctorate degree in athletic training. Like, I don't know why I was intimidated, but I'm like, I'm going to do this. So I did it first and foremost to kind of solve my own problems. And then it turned into a big passion. And
Gotcha.
that's where my research now lies. And I also run my own business helping other women with this as well. So
awesome.
yes.
Yeah, I kind of got into it. I've also been an athlete pretty much my entire life, particularly with swimming. And forget what year it was, but in like 2016, 2017, before I was in like any sort of like athletic training program, they had like compression suits, and if it was allowed to do like quick flip turns and things along those lines of when you are pregnant. And one athlete did it, and she killed it. She did awesome. Like, her results were awesome. But the whole community, and then a lot of other just like sports and athletic fans were all kind of debating it. And it's always kind of been in the back of my head of something that I wanted to research, and I never really knew like how to do it other than like Google. And then I got into a professional program, and I was like, this is awesome. Like, now I have a way to research it, which is perfect. So not a mom, but definitely still interested in the area. And yeah, that's one of the things that sparked this topic as my research topic for this project. So in your background and places you have worked, have you ever had a pregnant athlete continue to compete?
Mm-hmm. So I should say that currently I am not practicing as a clinical athletic trainer. I'm strictly in a teaching position right now, but I have helped a couple of our collegiate athletes here, most recently a track athlete. And she competed while pregnant for a while. And mostly I kind of picked up with her after the baby was born.
Gotcha.
So yeah, but like I said, I help a whole range of clients now on the side of my business, and they range from, moms who casually want to jog to I have some serious CrossFitters, marathon runners that I work with. So as far as collegiate athletics, yeah, it depends. I think it's important to note the most current research, because it used to be, I think you brought this up somewhere in the outline you gave me, but the old advice used to just be, just keep doing what you're doing, right? If you become pregnant, just keep doing what you're doing. And that was it. And we know so much more now. Unfortunately, that is the prevailing advice, but we know now most current research does suggest that we start, scaling down running and jumping. So the high impact activities by the end of the second trimester. So ideally, even if they're in a non-contact sport, such as track, we do want to start deloading that impact for the preservation of the pelvic floor. Because as the belly gets bigger and the baby gets bigger, and that weight will increase the stress that's on the pelvic floor. And then if you add running, jumping, we do know now that will increase the stress that the pelvic floor is undergoing. And of course, that after birth, after the baby's born, that could make the recovery harder. So it's not so much just do what you've always done up until the day you give birth. And we know better now that to start tapering those kind of things. So it really depends. Now, obviously, your contact sports, most guidelines say through the first trimester, a contact sport is generally okay with a healthy pregnancy. And kind of that rule of thumb is once we start seeing the belly start to protrude, we want to reduce or completely eliminate contact. And then maybe even a little sooner when we're looking at kind of the extreme sports. So things that really generate some real velocity. So I'm thinking like downhill skiing and even horseback riding for the risk of falling. So equestrian, things like that, we would want to use some more caution.
Gotcha. And then is there any sport that you would kind of push past that point of waiting till you can see that they're visibly pregnant or anything along those lines? Are there any sports that you're like, okay, like with the intensity of it, you can keep going? Or is it pretty much that second trimester is where we're the good rule of thumb of where we're
yeah, so again, every pregnancy is different. So even if the same woman has multiple pregnancies, they might experience some different feelings. But generally by the end of that second trimester is, again, when we want to start tapering down the running, the jumping, and the impact for the preservation of the pelvic floor. Now, some women might start showing some symptoms of pelvic floor dysfunction earlier in pregnancy. It's generally not till about the second trimester, but I've definitely had some women who, in the second trimester, they're peeing their pants. They're experiencing urinary incontinence from that stress, especially if they're carrying multiples. That stress is even more. So there are some sports that I could see going into the third trimester. And again, it's all modified. So it's not that we can't, if say you have I'll go back to my track athlete, like if she was a sprinter, we might tone it down to some less impactful activities. She can still get her cardio in. A lot of people will switch to like a, Stairmaster, elliptical, things like that. But yeah, we do generally, again, this is the best research we have. And
Right.
some athletes, and I think it's almost like the pendulum has swung really, really far. That it used to be like you got pregnant and you should just lay on the couch and rest and wait for the baby. And it's actually not healthy. We want the benefits from exercise. But sometimes I think some people try and swing too far to the other side. Like, oh, I ran a half marathon the day before I went into labor. And while if that's what you want to do, I'm never going to tell anyone like, hey, don't do that. But also, like, you're not free from the consequences that could happen, right, as far as, that pelvic floor dysfunction and symptoms like that. So, yeah, it's a fine line of kind of managing each patient individually, really.
Gotcha. No, that makes total sense. In regards to athletics and performing at high levels, or just kind of performing in general, how does the body change, and what are things that athletes have to think about when starting a family in regard to like other people, not like you don't have like physically active and non-physically active? How does that differ in the role of pregnancy?
Sure. So some of the major pregnancy changes we experience right away, really, as far as we have the typical symptoms I think everyone's familiar with, like fatigue and nausea and things like that in the first trimester. But we also, especially as athletic trainers overseeing a pregnant athlete, we need to understand that their tolerance for heat, high altitude, and things like that, it decreases. So that even if they are from a hot region or, a region of lower altitude, it's going to impact them quicker. So they're going to have a lower tolerance. So that we're going to have to modify what they're doing out in the heat and then the altitude during pregnancy, even in the first trimester. So those are two things I can think of right off the bat as far as they're going to have to train differently. And then, of course, how we load the core and the abdominals, it changes drastically during pregnancy. And I would say, like, you can still lift heavy during pregnancy, but again, like, what's that threshold? Where is that upper limit of that's enough stress on the pelvic floor? So I would say those are kind of the big changes that they go through during pregnancy. And then afterwards, certainly not enough attention is spotlighted on this. Without going, you told me I was allowed to go on a tangent.
Totally good to allow. Yeah, absolutely.
This will be a little one. I think our society is very much like, we see pregnant women as special, for lack of a better word. Oh, you're pregnant, you're glowing, it's so exciting. And then after the baby's born, our Western society is very much like, okay, great, now get back, lose the weight, get back to work. And it's very like the baby's born and like that ends. That honoring this season ends. And unfortunately, I see that a lot with women pursuing fitness. There's not a great recovery timeline here in the United States, especially. But and we have to consider things, like you said, between someone who's starting a family and not starting a family. Is this woman going to breastfeed for the recommended year, or even try breastfeeding? Because when you're breastfeeding and the milk comes in and the breasts are engorged, that impacts you trust me, you can't run. That's very painful. And so you have to, especially if you're working with a postpartum athlete and she's breastfeeding, it's 6 months out, 8 months, a year. When she pumps, she's gonna have to pump around her workouts, preferably beforehand. So all of those things I think really play into it. Like, is her body still trying to nourish another while she's returning to exercise? So I think that's really huge. And again, it's just kind of not thought about very often. And then, of course, the core, the abdominal muscles stretch out. They need to be completely rehabbed so that we're not experiencing things like, hip, back pain, pelvic pain, because the core isn't strong, because that can impact that. And then, of course, the pelvic floor. It is not standard of care in the United States for any pelvic floor therapy. I think everyone should get at least one appointment postpartum, one during pregnancy and one at least postpartum, to see if there was any damage, if she is having prolapse, which if you don't know, prolapse is when the uterus starts descending down into the vagina, and that's obviously not a good thing. And we want that to make sure that everything's healed before progressing back into exercise. So those would be some things I would think that they have to consider is, yes, your body will change. And yes, if you're going to continue pursuing fitness, athletics in any way, you are going to want to see a pelvic floor therapist. You're going to want to work with someone to rehab those foundational things before we move into exercise.
And then are you able to kind of paint a picture of if someone were to go and get pelvic floor therapy, what that would look like first appointment versus at the end?
Sure. So pelvic floor therapy, I am not a pelvic floor therapist. I always want to make sure people know that. Like, I do not do internal work. I treat patients externally, because at a pelvic floor therapy appointment, they can do internal examinations. So they will go into the vagina and see, they can assess the pelvic floor muscles through the vagina. So that is what we call, gold standard, is to make sure that everything internally is okay. So again, that there's no prolapse. They will check especially if you had any tearing, which is common during childbirth. 85% of women have some degree of perineal tearing, so the tissue between the vagina and the anus. So they want to make sure that the tearing healed. And lingering scar tissue is a huge reason that women continue to have pain in the pelvic floor vaginal region after childbirth, because that scar tissue, we see as athletic trainers, we've seen post-op scar tissue in other places, right? ACL rehab and things like that. And we know that scar tissue needs to be mobilized and taken care of. And so a pelvic floor therapist will be able to show, will do that for them if that patient wants, but they'll be able to give them the tools to do that scar tissue mobilization and massage there on the perineum. And so I think that's kind of the first big difference, is they can do the internal work. And then where I see it very similarly, and this is kind of where I step in as well and overlap with the PTs, is we do a lot of things that, again, as athletic trainers, we know how to do. Core stabilization, pelvic stabilization, teaching them how to, well, maybe not this as athletic trainers, but how to engage and relax the pelvic floor so that that muscle is functioning correctly.
And then would you say it's fair to say that patients are probably underutilizing these treatments that are available just because they might not know about it? I didn't know about it before researching it, so.
Absolutely. Like I said, I'm a professional in healthcare, and it took me 2 kids to even know that there was something called pelvic floor therapy. So yeah, I think it's definitely not utilized. Unfortunately, I don't know why the referrals aren't coming from the OBGYNs to go do it. And that is part of the message I'm trying to spread, is that a lot of states are also, they're open access. So you don't even need a referral from your primary to go to pelvic floor therapy. You can just, for most states, you can just call the pelvic floor therapist office and just schedule yourself an appointment. So it is wild that it's underutilized.
Yeah. In your professional opinion, what would you say the biggest misconception in high-level athletes competing? What's the biggest misconception with athletes being pregnant or postpartum athletes trying to come back to compete?
So for pregnancy, I think one of the biggest misconceptions, I think you wrote it down too, like the old school thinking is that exercise was dangerous for the baby.
Yes.
Especially strenuous exercise. And there are limits, of course, to everything. But there's a kind of, my philosophy is like, a pregnant woman is not, delicate, but she's also not invincible. So again, that we have to operate within those ranges. And so I think the biggest misconception is, again, very old school thinking, is that exercise is dangerous for the baby, even though research shows time and time again that it's not. And actually, there's a lot of great health benefits for both mom and baby to continue exercising. But I think that's one of the biggest ones, is that, my Facebook feed and Instagram feed is flooded with videos of moms lifting really heavy, and people, just the comments are just you're going to kill your baby and all this crazy stuff. And it's not. I think that there's just this, we're starting to see a trend moving in the right direction, that exercise is safe. And now we're moving into this, well, what about high level athletics, right? We know exercise is safe. And I think the recommendation is very similar to non-pregnant people. It's like, 5 days a week of 30 minutes of moderate exercise. So it's very similar for pregnant versus non-pregnant. But now we're getting into this arena of, well, what about high level athletics? What about professional athletes and collegiate athletes? And I think that's just the misconception, is that it's dangerous. When it's, as long as they're, again, being guided and they're being educated on the cues in their bodies to listen to stop exercising, then, like we mentioned, heat, altitude, if they start feeling contractions, things like that, then they know to stop. So I think it's, if they're completely uneducated and just, go lift something real heavy and no one's checking in on you and giving you any education, then sure, it could be dangerous. But, right. And then as far as postpartum, and it's a big stickler for me, is there's this misconception that at 6 weeks, which is the typical postpartum 6-week clearance. So after you have a baby, typical timeline is, again, could be a rant, but no one takes care of you until you're 6 weeks postpartum, which so much happens in that time. It's insane. But at 6 weeks, they're like, you're cleared. And I mean, just my experience, I remember with my first, like, the nurse was like, so, you're cleared now, and you can start doing some crunches, which, side note, crunches are not appropriate postpartum. They're not. And she's like, you can get back, just listen to your body. And so my question is, and I think this should, especially for athletic trainers, like, no one even asked me what exercise I was returning to. They just said, you're cleared for you. I'm like, why run? Like, that's fine. You're cleared to run. And for us, I mean, really, when we think back, would you ever would you ever have an ACL patient, they had surgery, and then you wouldn't see them for 6 weeks. And then just at 6 weeks, they were like, just listen to your body and
hope it doesn't re-tear or anything
and you're
like
probably
that.
good to go. So, I mean, if that's not wild.
Yeah.
But that's the care that women are getting. And again, no one even asked me what I was doing. So the clients I see, it's because they get cleared the 6-week appointment. And like I said, some of them are very intense CrossFit people. And they're like, I tried to go back to the gym at 6 weeks and I was in pain and I peed my pants and and then it just sets them up for disappointment, right? Because their doctor said, your body should be fine. And when it's not fine, they're thinking, what's wrong with me? Am I the only one who's going through this? And I just think there's just this very vicious cycle of dismissal for women's care in this arena particularly. Yeah,
I think some other misconceptions that I saw, I did a little bit of research and looked at some books and everything along those lines. And I also saw patients don't know like how many doctors they're going to see from the minute they know that they are pregnant to postpartum, that 6 weeks. Do you know how many on average, how many doctors people see?
I don't have the number of doctors necessarily, but I'm thinking like prenatal. Like if you pick a physician, an OBGYN, a provider, there's quite a few appointments, and especially as you get in the 3rd trimester, they're checking on you every 1 to 2 weeks. So there are a lot of appointments, and then postpartum, I hinted at like there are not enough appointments.
Right.
Yeah, we're flooded with all these prenatal appointments, and then afterwards, like I said, society is sort of like, okay, well, we're done with you. You've had the baby. We'll see you in 6 weeks.
Yeah.
And so I think that needs to be bumped up as well. Like you should be seeing, I would love to see a 1 week, a 2 week, and maybe the 6 week postpartum checkup for mom, for the person who gave birth. And then after that, like at 6 weeks, that's nowhere near enough. And then that's where I think a pelvic floor therapist can come in. And that typically looks like every 1 to 2 weeks until symptoms resolve. So.
Gotcha. And then I also saw that nutrition becomes difficult for patients just because they don't know how it's going to change, how much they need to eat. Then they feel like they're eating too much or they're not eating enough for the baby. And it causes a lot of, from what I read about, a lot of anxiety of, is what I'm doing okay for the baby? Is what I'm doing okay for me? That was a large misconception that I saw. I don't know if you have anything to add about that, but that was one.
Yeah. So Yeah, so with respecting what we can do as athletic trainers as far as nutrition, but
Right.
often general guidelines, the caloric need actually during the first trimester is almost nothing. Like there's no increased need. So some people, like as soon as they're pregnant, they're like, yeah, I can eat whatever I want. And physiologically, there is no need for that. And most women, they're very nauseous, and their calorie intake goes down a lot in that first trimester because they can hardly keep anything down. So trying to eat health, and that's a huge for an athlete, right?
Mm-hmm.
Trying to maintain nourishment for your body and the babies while if maybe you're throwing it all back up is very difficult, and hydration can become an issue as well. And some women do need to be hospitalized for extreme vomiting and dehydration during the first trimester. Typically, the second trimester, they're feeling a lot better. Caloric needs really only go up a couple hundred, like 1 to 2, 3, I think, 100 calories. It's not much. And then the third trimester, it's up to 300 to 500 extra calories. So yeah, that is hard to manage for people who are exercising as well, because they have to consider their exercise caloric expenditure. And then I think postpartum, it's even more difficult because the big, again, you're talking about misconceptions. Some people think, oh, well, when you're pregnant, you need to eat. And when you're postpartum, you need to be like dieting and lose the baby weight. If you are breastfeeding, you actually need some, depending on if you're exercising or not, like up to 1,000 extra calories to produce enough breast milk for the child. So even if you're not exercising, it could be upwards of 500 calories. And the hydration you need, because all the water, I feel like it's going to making breast milk, and the electrolyte balance and things like that is actually much more, I don't want to say complex, but it's more of a need than people realize. So I think that misconception is that during pregnancy is when you eat, and really we need to, and again, I said our society is very much like, go back, you need to be back at work. Some people it's 6 weeks.
Yeah.
And I think that puts pressure on women to have already lost all the weight, got to fit back into your work clothes and whatever. And it's unrealistic, because what people don't understand is the weight we gain during pregnancy, some of it is to maintain the ability to breastfeed for the child. So you're going to hang on to some of that weight the entirety of your breastfeeding journey, whether that's 6 months or 3 months, 6 months, a year, whatever you can do, are able to do. And I think that's just where people women get frustrated, is like, well, why do I have this extra weight? And it's for a purpose, whether you choose to or are able to breastfeed or not. That is what the weight gain is designed for. So especially when we're talking about athletes, like you mentioned, swimming, and that culture with wearing swimsuits and track, cross country, that's where I see a lot of in gymnastics. We want to drop that weight very quickly, and it's not healthy for you. Research shows that it takes about 18 months after giving birth to do what we call nutrient replenishing of the body. So it takes 18 months to replenish all the nutrients that your body gave during pregnancy and during breastfeeding. So I think that's a really interesting thing to keep in mind too, that you might not get your nutrient levels back to where they were for 18 months.
I did not know that. That's crazy.
Yeah.
So I know we kind of talked about the policies that were put in place before and what we used to know. But the NATA position statement says that there should be a policy in place to handle student athletes who become pregnant. What are things that you believe should be included in this policy, either high school, collegiate, we can focus on either one. But some different things that should be in place, either within the school or within the athletics program, to care for these athletes.
Sure. So I actually have it pulled up here. It's a presentation I gave at GLADA. I can't remember if this is the one I did at GLADA or NATA, but anyways, and it's an excerpt from Title IX. And I highlighted some things that I think for athletic trainers specifically to know is really important. So some of the things that are in Title IX include that even, financial aid cannot be taken away or withdrawn, even if a student athlete presents in a condition that they're not able to participate. So this needs to be extended. So, if someone was on a scholarship and they got a knee injury, they typically don't lose that financial aid. But in the past, it was revoked for pregnant women. And now that is protected under Title IX. So I think it's important to understand that. And Title IX requires it to extend the same treatment to pregnant athletes. So in there, it also says that athletes with other medical conditions are treated a certain way. They receive certain medical treatment, athletic training services, and it says that we are required to extend that same amount of treatment to pregnant students. So I think in the past, I know when I was in athletic training school, like everything was athletic training school. When I was in school for athletic training, everything was just sort of like, I feel like everything you came up with was like contraindication, pregnancy, contraindication, pregnancy. It's like, oh, we don't do that. We don't do pregnancy. And that's just not the reality anymore. So if someone comes to you, your athlete is pregnant or postpartum, like I'm not saying you have to be the expert, but we have to help them. And the interesting thing too is if this person is continuing to participate, and she sprains her ankle or she pulls her hamstring while pregnant, like, do you understand how to continue her treatment for even those orthopedic things with respect to her being pregnant?
Right.
Because some of the positioning is going to change. I'm thinking like hamstring, we can't be having her lay on her stomach in the second and third trimester to do some, resistance with any hamstring there, curls or anything like that. So we have to be creative. And so we have to, and I think for me, you have to have people who can help you in your network. So if you don't know how to help this pregnant or postpartum athlete, then you better find somebody who does, right? You better have a pelvic, like to me, in my mind, if you're working with high school or collegiate women who have the potential to become pregnant, there's no reason that a pelvic floor therapist isn't in your network. Even if it's just hey, we'd love to have just your card and your information, and can you tell us how we can best refer our athletes to you should we need to. It's as simple as that, to have it. We have a emergency action plan for everything else. We have protocols for everything else, and this needs to be in place as well.
Yeah, I know a lot of what we've talked about is the way that hormones can alter or change your body and make you more prone to injury or make you more have more laxity or things along those lines. And I think that's something that I definitely didn't think about before coming into this program and working on this project. Of if they're pregnant, they can also become a lot more prone to injury because of those different hormones and that different laxity in the body starting to release more hormones to relax in order to deliver the baby. And it's a lot of learning that I did on my end that I definitely wouldn't have known. But it's also something super interesting and super important to remember that these athletes, they're still athletes, they're still students, they just happen to be pregnant and we still have to care for them.
Yeah, it's a medical condition like any other, right?
Yeah.
So I'm thinking, we help students with other conditions, and we have to be prepared to do this one as well. Yeah, and I'll just point out the other thing, in Title IX, it says that we are legally required to let pregnant athletes participate in sports as long as their doctor certifies that she's medically able to. And I think it's just important, again, to collaborate and have that timeline of, okay, based on this sport, because again, some physicians might not realize the impact, intensity, or contact that's in each sport. So working with them closely and expressing any concern you might have is good, but just know that if the doctor says they can participate, they can. And then lastly, we are legally required to provide the same level of assistance and rehabilitation to return to game shape for any other injury. So postpartum, again, we can't just be like, ooh, I'm not really sure how to help you. Sorry. We actually have to. So I think that comes in, again, with collaborating and working closely with their pelvic floor therapist, or someone like me, a PCES, to make sure that their exercise is modified appropriately until it's like a progression with any other injury. So,
absolutely. I know that pelvic floor dysfunction is one of your areas of expertise. Would you be able to walk me through the process of how you would either, if I'm not 100% sure, are you diagnosing or are you getting someone who is diagnosed and then and then giving treatment for that?
So it just depends. Some women, like I said, I don't work with collegiate athletes right now.
Right.
If that were my setup, then I would for sure 100% say, hey, you need to go see a pelvic floor therapist. So if I'm working at a university or something, I would say, yeah, you need to go see the pelvic floor therapist, get diagnosed, and then we can work on your protocol, like whatever that would be. That's what I would do if I were still practicing. Because I'm practicing as a PCES and not as an athletic trainer, where I'm able to, I sometimes I do have them start and see a pelvic floor therapist first. But the other thing we need to realize too is, because this is orthopedic, like the pelvic floor ultimately is muscles and ligaments. And if you're trained like I am to understand how they work, because most people aren't, we just skip over that conveniently in anatomy and everything,
right?
Who wants to learn about anything that pertains to women? So if they come to me because I'm already trained in that, yes, I generally can figure it out based on history alone. If I'm not sure, or I think it warrants, some conditions warrant an internal examination, or if upon, my history taking that, I find out like, yeah, they had a 4th degree or 3rd degree tear, and I have a suspicion that there's lingering scar tissue, because I don't work anything internal. I always say like pants stay on, like I don't do anything of that nature. I would definitely refer to have them seen to make sure that scar tissue was taken care of. And the other thing some people don't know is like you can have internal scarring as well inside of the vagina from childbirth. So that would definitely be something. So it just depends on the condition that I think that there's going on. But generally, I am able to understand what's going on with their pelvic floor. Sometimes it's a lot of times people think it's like, oh, my pelvic floor must not be strong. Those muscles must not be strong. But sometimes it's a coordination issue. Mm-hmm. Like any other muscle, they're just not firing the correct sequence at the correct time when we want them to. And other times it's total opposite. They carry a lot of tension or high tone in the pelvic floor, and they don't know how to relax the muscle. So again, this is stuff that we know. It's just this region that, again, for some reason we don't learn about. So once you learn about it, we know how muscles function. So it just comes down to, most women, are they carrying a lot of tone? And you'll see that as like a tight pelvic floor, even though we know that's not really correct. But are they carrying a lot of tension there? Are they not able to generate a lot of tension? And or is it just firing out of sequence? So I know we know, but like just for example, because I know the pelvic floor is very mysterious for people. So this is how I explain it to my clients, right, who don't know anything about anatomy. I'm like, think of your bicep muscle. If your pelvic floor is carrying a lot of tension, it's like if your bicep was squeezed all day long, right? And it's overactive, and we need to learn how to relax it. On the other side, if your pelvic floor is having trouble generating tone, it'd be similar to like, okay, I'm having trouble generating enough muscle engagement to flex my elbow, to engage my bicep. Or is it just firing out of sequence? My pelvic floor should be engaging, but it's not when I need it to. And that's when we see things like urinary incontinence and the leaking.
Gotcha. And then what are some exercises or rehab that you have some patients do, if you're able to share?
Yeah, no, I can do a little quick little demo just for fun, because the very foundational thing that I do, the most important thing to understand about pelvic floor function is it's controlled by the diaphragm. A lot of people don't know that. So if I know diaphragm also sometimes is like this mysterious thing, but if we remember, diaphragm's up here, and when we inhale, the diaphragm goes down and it expands. Now that inhale and that diaphragm expansion should tell the pelvic floor to relax. Okay, so that's how we get relaxation in those muscles. And when we exhale, diaphragm comes back up, and that should tell the pelvic floor to engage and lift as well. So inhale, pelvic floor relaxes. Exhale, pelvic floor engages. And a lot of people don't know how to engage their pelvic floor correctly. And so this is where I start with everybody. But we have, to keep it simple, we have superficial pelvic floor muscles. They're the ones that we squeeze when, like, oh, I don't want to pee, right? And that's usually all women. That's usually the extent of the education. Like, yeah, just squeeze like you don't want to pee your pants. But that only gets the superficial layer. And then we have the deep layer, and those are the muscles that lift the pelvic floor, which is really important because that lift is what houses like the bladder and the uterus and supports them. So if those muscles aren't engaging, that's, again, we start seeing things like leaking and prolapse because those deep muscles aren't being activated. So the easiest way to teach people how to engage their pelvic floor is to assess their breathing and see if they're dysfunctional breathers, which most women are, and especially during pregnancy, because the belly gets really big, they run out of room, and they start breathing up into their chest, which is a dysfunctional breathing pattern. So ideally, if you had a hand on your chest and a hand on your belly and you took a nice deep breath, you would want to feel your chest hand with almost no breath going into it. So we don't want to be breathing like that. That's a stress-inducing way to breathe. And if you breathe up, your diaphragm can't go down. And so your pelvic floor will never get the message to relax. And so it stays in that tight, high tension state. So that's where I start with people, is teaching them how to breathe. I know that sounds really weird, yeah. But we teach them how to breathe because ultimately that will tell the pelvic floor when to engage and when to relax when it's supposed to. And then some other things we do is some deep core exercises. So I'm not sure, again, revisit it if you need to, but the transverse abdominis muscle, which is on the sides, and it's the corset muscle, and it helps draw everything towards the midline. And that's really what we want to see, because those expand when we're pregnant. So they're here, they get really stretched out, and we want to rehab them to bring them back in. So any muscle or any activity or rehab exercise that would engage transverse abdominis is also very key.
Gotcha. Awesome. And then as an athletic trainer, what are things that can be done to support a pregnant athlete who's in your program of athletics, whether that be if they're planning to become pregnant, while they are pregnant, or after they give birth?
Sure. So I think first and foremost is, for most people, again, generalization, but if you're working in high school and college athletics, for most people, it's probably an unexpected pregnancy, right? And so first and foremost, I think how you interact with that athlete and make her feel as far as being supportive is going to go a long way, because, you know, an unexpected pregnancy is very emotional and hard to deal with. And especially when you're trying to figure out if you're on an athletic scholarship and things like this, it's very stressful. So I think first and foremost, of course, that your rapport you have. But I think if they're knowing if they want to become pregnant, which is great, you know, things like prenatal, clean eating leading up to it. Obviously, if they're trying to get pregnant, reducing or eliminating alcohol, making sure they're not smoking, things like that. And then I think just if they are pregnant, understanding those limitations for prenatal exercise, educating them like, hey, you know, here's a whole list of signs and symptoms that, you know, if you're out at the track, let's just say, because not a lot of people are covering every track practice, right? Like, right. Hey, if you start feeling dizzy, lightheaded, anything like contractions, and we have to explain to especially first time pregnant women, like, what does a contraction feel like? Some of them are like, what is that? I don't even know. I had the client who we were actually in the middle of a session. She's like, man, I'm just feeling like pressure come and go in my pelvis. And I'm like, you're having contractions. So that was funny. So like they have to know what it feels like. Okay. And then I think I mentioned, I think every pregnant person should see a pelvic floor therapist at least once, because it's not uncommon for people to have that high tension pelvic floor before they even have kids, especially athletes. They're doing a lot of, if they're doing lifting and running, their pelvic floor usually is that tighter or more toned. And to have a successful vaginal delivery, which is what we want, right? We don't want to have a C-section. The pelvic floor actually has to relax and lengthen to deliver the baby. And if it's really, really tight, they need to start learning now how to relax it and lengthen it and have that proper function. And then, of course, after they give birth, I mean, making sure that, well, I should hop back. Sorry, I had notes right here for pregnancy. But I think as athletic trainers, right, we're so used to being this hub. And it's okay if you don't know everything. And I think helping her find an OBGYN, because again, it's probably unplanned, but finding an OBGYN, talking about what a midwife is, which a midwife is much more practiced in the actual art of delivery. A doula, which if you're not sure what a doula is, that is a pregnancy, like a birth support person. So like when you are in labor, especially if this pregnant woman doesn't have another support system, a doula would be a fantastic person. They help with pain control during labor and delivery, and they help advocate for, you know, if she wants to have a vaginal delivery and the doctors start hinting at different, interventions and things like that, the doula can say, nope, this is what she wants. Okay, so that would be a fantastic resource to help her connect with. And then make sure that she, again, if she wants to breastfeed, that again, help her find maybe a lactation consultant and make sure that they have all those things lined up. And then after birth, like I said, you don't have to know all this stuff, but having those people in your network is the most important thing. So that way you're not going, I don't know, I'm not really sure what to do with you, and you're spinning your wheels. And it's great to already just, and I can't stress that enough. I stressed this at NATA and GLADA when I did this. I'm like, if you have females at your college or high school, like, you should have a pelvic floor person in network. So just do that today. Like, pelvicrehab.com is a fantastic source to find someone on the map near you, a pelvic floor therapist.
And then my last question was, anything else that you wanted to add or points that you wanted to discuss that we didn't touch on?
I think we covered everything pretty well. The one thing I will say, for athletic trainers is you can help this population. I think just historically, since women and pregnant women have been discouraged from athletics, and that landscape thankfully is changing, and we need to also kind of keep up with that movement. As far as, like I said, when I was in school, everything was like, oh, contraindication is pregnancy. Oh, we just don't do that. And I think we need to start evolving and realizing that we can help this population, because a lot of the problems, after I see women even after pelvic floor therapy, because they're still leaking, because, and mad respect to PTs, right? But a lot of times what I'm seeing is the PTs will, like, they graduate, but they haven't progressed them all the way up to, like I said, like these CrossFit people, right? And these marathon runners. And it's not that the pelvic floor therapist isn't skilled. A lot of times they're limited by insurance, like there's only 10 visits and then they didn't get that far. But we know how to do a lot of that stuff. If you can trust that they've learned what they need to learn for the pelvic floor from the PT, and then we know the kinetic chain, right? I've had some women who are leaking, and the real problem, the whole root of what was going on, is she had like some plantar fasciitis, some arch issues, in which if the feet aren't absorbing the shock correctly, right, we know it's going to go up the kinetic chain, and then it gets to the pelvic floor, and she was leaking. We got that plantar fasciitis under control, got some better arch support, and what do you know? Magically stopped leaking. So she had the tools from pelvic floor PT, but she needed someone else to look at the whole kinetic chain and put it into this athletic arena. And just things like that I think we're kind of, we're the experts in getting people back to athletics, and just have the confidence that you know how to do a lot more of this than you know. You refer for the pelvic floor stuff, and then a lot of it you already know, as far as kinetic chain and core stabilization, pelvic stabilization, strengthening the glutes. We know how to do that stuff. So I think just anything else, you don't have to be a pregnancy and postpartum expert, person like me, but you can reach out, find those people, and have more confidence in yourself that we can help these people. And it's not just, we don't want to be part of the dismissal cycle that I see a lot of pregnant and postpartum athletes go through, right? Yeah. Is there any other questions you had?
I do not. That was everything I had. So thank you so much for taking the time. I really appreciate it. If anyone watching wants to contact you or learn more, where would you direct them?
So if you want to email me, I'll do my business email, just so it's specific to this stuff. It's support at athleticwe.com. That's my email that you can reach at. My website, if you I have some frequently asked questions and resources, free resources on there, like a diastasis recti guide, things like that, that could be helpful to get started. It's just athleticwe.com. So that could be a good place to kind of get started, but you can always share that information and write it down. But yeah, please, I welcome. And I've actually had, after I presented at GLADA and NATA, I've had some athletic trainers email me and they're like, I'm so sorry, but I have a pregnant athlete and I have a question. I'm like, don't be sorry. That's like what we're here for. So I think if we can start helping each other and, like I said, build that confidence that we know what we can help here, for sure, I'd be happy to help with that.
Perfect. Awesome. Well, thank you so much. I really appreciate it. I definitely learned more about it, so I'm sure people watching also did. So yeah, if anyone watching has any questions, feel free to reach out to me or reach out to Allie using that email that she just provided. And yeah, I really appreciate it. Thank you.
My pleasure. Thank you.